Ever wondered why typhoid, a disease of the past, still impacts millions of people worldwide each year? Well, let's delve into it. Typhoid is a bacterial infection that has been around for centuries. It is caused by a bacterium known as Salmonella Typhi. This bacterium is a wily foe that has managed to survive and thrive despite advances in medical science. The history of typhoid is a long one. It's believed to have been responsible for several epidemics throughout history. In fact, the most famous case of typhoid is probably that of Typhoid Mary, a cook in New York in the early 20th century who was a carrier of the disease but never fell ill herself. She unknowingly infected dozens of people, and her story is a stark reminder of how easily this disease can spread. Typhoid may be an old disease, but it's far from extinct. In fact, it continues to be a major health concern, particularly in parts of the world where access to clean water and sanitation is limited. Every year, an estimated 21 million people worldwide contract the disease, and about 200,000 succumb to it. These numbers paint a sobering picture, but they also underscore the importance of understanding this disease. It's easy to think of typhoid as something that doesn't affect us in the modern world, but the reality is different. Typhoid is a global problem that requires our attention and understanding. The symptoms of typhoid are often similar to those of other illnesses, which can make it difficult to diagnose. It typically presents with a high fever, stomach pain, and sometimes a rash. Without treatment, it can cause serious complications, even death. So why does typhoid continue to persist today? The answer lies in a combination of factors, including poor sanitation, lack of access to clean water, and inadequate healthcare. It's a disease that thrives in conditions of poverty and neglect, and as long as these conditions exist, typhoid will continue to be a problem. Understanding typhoid helps us protect ourselves and our communities from this persistent disease. It's a reminder of the importance of clean water, good sanitation, and accessible healthcare. And it underscores the fact that diseases of the past can still pose a significant threat today. So, how does this disease, typhoid, spread among people? Well, typhoid is caused by a bacterium, Salmonella Typhi, which is usually found in the intestinal tract of humans. This bacterium is shed through feces and can contaminate water and food. When someone consumes this contaminated water or food, they can contract the disease. Let's delve a bit deeper into this. When a person with typhoid uses the restroom and doesn't wash their hands properly, they can unknowingly pass the bacteria onto objects they touch. This could be anything from a faucet handle to a food item. If another person touches these contaminated objects and then touch their mouth or food, they may ingest the bacteria. This is why typhoid is often associated with poor sanitation and hygiene. Now let's talk about carriers. A carrier is a person who has been infected with the typhoid bacteria but may not show any symptoms. Yes, that's right, they can seem perfectly healthy but can still spread the disease. These carriers can shed the bacteria in their feces for years after infection, posing a long-term risk for the spread of typhoid. In some cases, carriers work in food handling or childcare, which can lead to outbreaks of the disease. This is especially true in areas where hand-washing facilities are inadequate or not used properly. It's also worth noting that typhoid can spread through direct contact with an infected person. This means that if you share personal items with a person who has typhoid, or if you come into close contact with their feces or urine, you could potentially contract the disease. So, what can we gather from all this? It's clear that the transmission of typhoid is closely linked to cleanliness and hygiene. By maintaining good hygiene practices, like washing hands properly and regularly, we can significantly reduce the risk of spreading or contracting this disease. Cleanliness and hygiene play a crucial role in preventing the spread of typhoid. How do you know if you or someone else has contracted typhoid? This is a crucial question because early detection of typhoid symptoms can lead to a prompt diagnosis and treatment, potentially saving lives. Typhoid fever is a bacterial infection that can cause a myriad of symptoms. However, the symptoms can vary from person to person, and they usually develop 1 to 2 weeks after exposure to the bacteria. One of the most common symptoms is a high fever, which can reach up to 104 degrees Fahrenheit or even higher. This fever typically starts low and increases gradually over several days. It's often coupled with a slow heart rate relative to the high fever, a phenomenon known as relative bradycardia. Alongside fever, individuals infected with typhoid may experience headache, which can range from mild to severe. They may also feel weak or fatigued, making even simple tasks seem challenging. Stomach pain is another common symptom, often described as a dull pain in the abdomen. This discomfort could be accompanied by constipation or, in some cases, diarrhea. Some people might also experience loss of appetite and significant weight loss. Other symptoms can include a rash, usually composed of flat, rose-colored spots on the chest and abdomen. In severe cases, individuals might experience confusion, agitation, or even hallucinations. It's important to note that these symptoms could also be associated with many other illnesses. So if you or someone else is experiencing these symptoms, especially if they persist or worsen, it's critical to seek medical help immediately. Remember, typhoid fever is a serious illness. If left untreated, it can cause serious complications, including intestinal bleeding or perforation, which can be life-threatening. In conclusion, knowing the symptoms of typhoid fever is the first step towards early diagnosis. These symptoms include high fever, headache, stomach pain, and in some cases, a rash or mental confusion. If these symptoms are present and persist, don't hesitate to seek medical attention. Recognizing the symptoms of typhoid can lead to early diagnosis and effective treatment. So, you suspect you have typhoid. What next? Well, the first step towards a proper treatment plan is an accurate diagnosis. To confirm a typhoid infection, doctors generally rely on two main types of tests: blood tests and stool cultures. Let's start with blood tests. They are usually the first line of investigation when typhoid is suspected. You see, when Salmonella Typhi bacteria invade the bloodstream, they trigger an immune response. This response produces antibodies which can be detected by a blood test. However, it's important to note that the sensitivity and specificity of blood tests can vary, and a negative result doesn't always rule out typhoid. Then we have the stool culture. This is a test in which a sample of stool is cultured in a laboratory to check for the presence of Salmonella Typhi bacteria. Stool cultures are typically more accurate than blood tests, but they can take a few days to produce results. In some cases, a urine test may also be done to detect the bacteria. Additionally, a complete blood count, or CBC, might be ordered to check for anemia or a low platelet count, both of which can be indicative of a typhoid infection. Now, you might be wondering, why is an accurate diagnosis so important? Well, typhoid can present with symptoms similar to other illnesses like malaria or dengue, which can lead to misdiagnosis. And a misdiagnosis can result in delayed treatment or even inappropriate treatment, which can make the illness worse or lead to complications. Moreover, accurate diagnosis is important for public health reasons. Identifying a case of typhoid helps in tracking the spread of the disease and implementing appropriate control measures. It also helps in monitoring the effectiveness of current vaccines and guiding the development of new ones. So, to sum up, if you suspect you have typhoid, it's important to get tested. The diagnostic tests, including blood tests and stool cultures, are your best chance at getting a definitive answer. And remember, the sooner you know, the sooner you can start the right treatment. Early and accurate diagnosis is crucial in the management of typhoid. Typhoid is treatable, but how exactly do doctors tackle this disease? Let's delve into the common treatments and strategies that medical professionals use to combat typhoid. The primary method of treating typhoid is through the use of antibiotics. These powerful drugs work by killing the Salmonella Typhi bacteria that cause the disease. The type of antibiotic used can depend on several factors, such as the geographic location of the infection and the patient's overall health. Some of the commonly used antibiotics include ciprofloxacin, azithromycin, and ceftriaxone. However, there is a growing concern in the medical community about the rise of antibiotic-resistant strains of Salmonella Typhi. This is where the bacteria have mutated in such a way that they are no longer affected by the antibiotics that were once effective. This makes the treatment of typhoid more complicated and underscores the importance of using antibiotics responsibly. In addition to antibiotics, supportive care is also a crucial part of the treatment plan. This can include rehydration to replace fluids lost through fever and sweating, and a nutrient-rich diet to help the body recover. In some severe cases, hospitalization may be necessary, particularly if the patient is dehydrated or if the infection has spread to other parts of the body. It's also worth noting that there is a vaccine available for typhoid. While it's not 100% effective, it can significantly reduce the risk of contracting the disease, especially for those traveling to areas where typhoid is common. But remember, even with these treatments available, typhoid can still be a serious and sometimes fatal disease. This is why it's so important to take steps to prevent typhoid in the first place, such as practicing good hygiene and safe food handling, and getting vaccinated if you're at risk. So, in summary, while antibiotics and supportive care form the cornerstone of typhoid treatment, the rise of antibiotic-resistant strains is a growing concern. And as with many diseases, prevention is key. While typhoid is treatable, prevention is always better than cure. So how can you protect yourself and your loved ones from typhoid? Preventing typhoid fever is not as complicated as it might seem. It's all about adopting a few simple yet effective habits and practices. Let's delve into some of these preventive measures. Firstly, there is the typhoid vaccine. Vaccination is a powerful shield against the disease, especially for those traveling to areas where typhoid is prevalent. There are two types of vaccines available. One is an injection, and the other is a series of capsules to be taken orally. Keep in mind, no vaccine is 100% effective, so additional precautions should still be taken. Next up, let's talk about safe food handling. Typhoid is often spread through contaminated food and water, so it's crucial to ensure that the food you eat is thoroughly cooked and the water you drink is clean. If you're traveling to an area with questionable water quality, consider using bottled water, even for brushing your teeth. Now let's discuss good hygiene practices. Washing your hands regularly and thoroughly, especially before eating or preparing food, can significantly reduce the risk of typhoid. Make sure to use soap and clean running water. If soap and water aren't available, use a hand sanitizer with at least 60% alcohol. Additionally, avoid close contact with anyone who has typhoid or is showing symptoms. Remember, typhoid can spread from person to person, so it's important to maintain a safe distance. Lastly, if you're traveling to a region where typhoid is common, consider taking preventive antibiotics, but always consult with a healthcare professional before starting any medication. Remember, early detection and treatment of typhoid can significantly reduce the severity of the disease. But as the old saying goes, an ounce of prevention is worth a pound of cure. So, taking preventive steps is definitely worth it. Prevention is the most effective strategy against typhoid. Let's recap what we've learned about typhoid. As we journeyed through this exploration of typhoid, we've covered a lot of ground. We've delved into the nitty-gritty of what typhoid is, how it spreads, its symptoms, diagnosis, treatment, and prevention. It's crucial to remember these points to stay informed and protect ourselves and our communities. Typhoid, an infectious bacterial fever, is more common than we might think. It's caused by the bacteria Salmonella Typhi. This bacteria does not discriminate. It can infect anyone, anywhere, and at any time. But it's particularly prevalent in parts of the world where clean water and sanitation are lacking. The way typhoid spreads is through the fecal-oral route, which is just as unpleasant as it sounds. It happens when an infected person's feces, containing the bacteria, contaminate food or water. When another person consumes this contaminated food or water, they too can become infected. It's a stark reminder of why good hygiene and sanitation practices are so crucial. Now, let's revisit the symptoms of typhoid. They're often similar to those of other illnesses, which can make it tricky to diagnose. They include fever, headache, stomach pain, and constipation or diarrhea. Some people may also experience a rash. The symptoms usually appear 1 to 2 weeks after exposure to the bacteria and can last for 3 to 4 weeks. Diagnosing typhoid can be a challenge due to its common symptoms. However, blood, stool, or bone marrow tests can help confirm a diagnosis. Remember, early diagnosis can significantly improve the outcome, so never hesitate to seek medical advice if you're feeling unwell. When it comes to treatment, antibiotics are the first line of defense against typhoid. They help kill the bacteria and treat the infection. However, some strains of the bacteria have developed resistance to certain antibiotics, making the disease harder to treat. This is why it's important to use antibiotics responsibly and under a healthcare professional's guidance. Prevention, as they say, is better than cure. And when it comes to typhoid, this rings especially true. Vaccination is a powerful tool in the fight against typhoid. Coupled with good hygiene practices, such as washing hands regularly and eating clean, cooked food, we can significantly reduce the risk of infection. That concludes our comprehensive overview of typhoid. It's clear that knowledge is our greatest weapon in the battle against this disease. By understanding how typhoid spreads, recognizing its symptoms, knowing how it's diagnosed and treated, and most importantly, how we can prevent it, we equip ourselves with the tools to keep our communities safe. Stay informed, stay healthy, and help fight the spread of typhoid.